talk about MPN symptoms and treatment side effects. Here's a question we received from a viewer before the program. How common is peripheral neuropathy in primary myelofibrosis, and what is the best treatment for it?
Well, by itself, it's not a very common symptom of MF by itself. Can it be a symptom? Sure. But there's also a number of things that can cause peripheral neuropathy. So I'm not sure there's a best treatment, but what needs to be done is a thorough investigation. There can be a number of causes. It can be nerve injury. It could be a deficiency in vitamins like B12. There's a lot of things that can cause it. So that type of a symptom needs to be thought of in a broad way in terms of diagnosis.
Okay. Jeff sent in this question. How can I manage the itching? Are there new treatments or strategies to live with itching?
Very common thing. And it's an interesting thing explaining to when we teach our trainees about this symptom, we all have to impress on them the fact that itching is not the itching that everybody else experiences. This is a very profoundly different symptom. It's debilitating for so many people. Had patients go to the emergency room for that. That's how terrible it can be. There's a lot of things that can be tried. JAK inhibitors, in my experience, have worked very well if we're itching, but not in everybody. We use sometimes antihistamines that can work well. Sometimes antidepressants can work well, not because they're treating depression, but because of other properties that they have. And sometimes UV light therapy can be a useful tool here too. A lot of patients swear by it.
Oh. Another common side effect is fatigue. Mm-hmm. Do you have any advice for managing this symptom?
Fatigue is the most common symptom across MPNs. And it is also one of the most difficult things to treat. Part of the issue is trying to figure out what does fatigue mean to the patient, right? When someone says they're tired, does that mean they're sleeping all the time? Does that mean they don't have get up and go? The first step is always understanding what does fatigue mean to the patient. And then the second is trying to dissect that. And in some cases, it's related to anemia. In some cases, it's not related to anemia, and it's just the disease itself. And in some cases, you have to think outside the box about general medical issues like thyroid dysfunction that could be at play here. So there isn't one best fit, but the first task is always to dig deep. When someone says they have fatigue, to dig deeper and try to figure out what does that really mean.
Mm-hmm. What other common symptoms do you hear about from patients, and what can be done about those?
Yeah, there's a lot of different things. It's a spectrum, right? And so I think that itching and fatigue are very common. Feeling full early, that's a big thing, particularly in myelofibrosis patients. Bone pain, that's another big one, particularly in myelofibrosis. There's not one therapy that is best for all, right? I think the JAK inhibitors certainly benefit many of these symptoms, but they don't benefit everybody, and not to the extent that makes it tolerable for everybody. So oftentimes we struggle with this and tried a lot of different things. But again, I think one of the things to always remember is we don't always want to say that this must be because of the MPN. Sometimes symptom is arising because of another medical condition that's going on concurrently.